Namaste. This is Dr. Shweta Atheeshwar, consultant in comprehensive and pediatric ophthalmology from Apollo Speciality Hospitals, OMR. Today I am here to chat about the common eye problems in children. Now, if we talk about the most common eye issue that children come to me for, it has to be refractive errors. Now, what are these refractive errors? A lot of children have problem focusing and seeing clearly. So, there are three main types of refractive errors, namely myopia or short-sightedness, hypermetropia or long-sightedness, and astigmatism or irregular vision. So, what is myopia? Now, a normal eyeball, as you see here, is spherical in shape, and the light rays that come from a distance come to a focus on the retina, which is the nerve of the eye or the sensient layer of the eye. Now, what happens in myopia is the eye, which is supposed to be a sphere, has grown a little longer from the front to the back. So, because the eyeball is elongated, the light rays come to a focus much before the retina instead of on the retina. This results in a blurry image, and the child is not able to see objects that are far away. So, this is called short-sightedness, and this is usually corrected by giving minus lenses in spectacles. Now, the other common refractive error is astigmatism, and that happens because the front of your eye, the cornea, which is the transparent circular structure in front of the eye, that is not spherical. One meridian is maybe more curved or less curved than the other meridian. This results in the light rays being focused as a line instead of as a point, and that causes a blurring and a reduction in the sharpness of the images. So this particular refractive error is corrected using cylindrical lenses. The other refractive error, which is not so common in children, is called hypermetropia or farsightedness. In this particular condition, the child is able to see objects that are further away, but has difficulty focusing on near work. So this happens because the eyeball is flattened. It is a little short from the front to back, and that results in the light coming to a focus behind the retina instead of on the retina. So how we correct this is by giving plus lenses in the spectacles. Now, a lot of parents are a little hesitant to start their children on spectacles very early on. This is a myth. There is no such thing as an age for wearing spectacles. If there is a refractive error, the child must wear spectacles. So what will happen if the child just doesn't wish to wear spectacles, or we just let it be and just ignore this? Well, that is not a very advisable thing to do. It may lead to something called as lazy eyes or amblyopia. Now, amblyopia occurs because the normal vision doesn't develop to its full potential because of a lot of reasons. The commonest one being uncorrected refractive errors. So what happens is, because the brain keeps receiving blurred signals from the eye, it assumes that that is the full potential of the eye, and the child may not develop 20/20 vision. So wearing spectacles is of utmost importance for normal development of vision. And the earlier we detect a refractive error, the better it is, because up to about 6 to 7 years of age, the treatment of amblyopia is most effective. It is not that, even if it is detected at a little later stage, now we do have modalities to treat lazy eyes, but the outcome is much more gratifying when the treatment is started at an earlier age. So that brings us to the other causes of lazy eyes. Now, what would hamper the normal development of vision? There are a lot of reasons. We just discussed refractive errors. The other very common reason is the presence of squint. Now, what is a squint? Our eyes are normally aligned to look in the same direction. Whenever there is a misalignment, one eye looks, say, outward or inward or upwards or downwards, it is called a squint or a strabismus. Now, this is another condition which a lot of us tend to ignore, or the popular opinion is that squints will go away as the child grows older. Well, this cannot be further from the truth. Squints in the first few months of life, say up to about 3 months, are still all right because the eye muscles are developing, the binocular balance is still developing. But any squint above 3 months of age needs attention. The child or the baby must be seen by an ophthalmologist to rule out certain life-threatening situations also, which may present as squint during the early years of life. So now squints, there are different ways of correcting squint. A few squints can be controlled with properly prescribed spectacles by themselves. A lot of squints do require surgery to realign the eyes properly. And why this is important, why we should not ignore squint, is because the eyes are aligned for a reason. Our depth perception, our binocular vision, and our three-dimensional vision depend on how well the two eyes are aligned. And I cannot overemphasize the importance of stereopsis or three-dimensional vision. Our day-to-day tasks, something as simple as threading a needle, requires 3D vision. Try doing it with an eye closed and you'll know what I'm talking about. So please do not ignore squint. Even if there is the slightest doubt, it is always a good idea to have it examined by an ophthalmologist. So that brings me to a very important question. When is the right time to get a child's eyes checked? If there is no problem in eye alignment, and if you think the other milestones are progressing normally, if your pediatrician certifies that the child's development is right on track, then about the age of preschool, about 3 years, would be a good time to get the first routine eye examination done for a child. And suppose a refractive error is diagnosed, suppose the child is prescribed spectacles, then it is a good practice to have it, to have a review done once in 6 months when the child is below 6 years of age, and annually after that. So this is as far as refractive errors and squint is concerned. Another very common problem that I see a lot of kids with these days is allergies. A lot of children have very severe eye rubbing, and there are two main types of allergic conditions in children. One is the seasonal allergic conjunctivitis, or it can also be a perennial allergic conjunctivitis, and the other one is vernal conjunctivitis. Now, both these conditions need to be treated with some eye drops and maybe sometimes, even anti-allergy syrups. And if left untreated, this eye rubbing can give rise to astigmatism. So these two are quite interrelated. And the other, all these conditions actually go hand in hand. A lot of children also have infections around the eyes. It could be in the form of a boil, it could be in the form of a conjunctivitis or a blepharitis. So these conditions are also easily treatable. Certain lid hygiene measures, frequent hand wash, cleaning the eyes with sterile tissues, and relevant antibiotic eye drops prescribed by the ophthalmologist can take care of these conditions. They should not be ignored. Of particular relevance in today's times is digital eye strain. A lot of our children are doing online classes for hours together, and the screen has become a one-stop solution for every need, not just for education, even for entertainment. So what this excess screen time does is it induces something called as digital eye strain. When we are looking at a screen, our blink rate goes down drastically. Normally, we would blink anytime between 15 to 18 times in a minute. This can go down to as low as 3 to 4 times a minute. What that does is it dries up the eyes, and when you don't have an adequate tear film in front of your eye, the vision becomes a little fuzzy. When that happens, you're not able to focus, you're not able to see clearly. That causes the eye muscles to sort of overexert themselves. That in turn can lead to brow ache, eye pain. That in turn can lead to headaches. Sometimes the eye muscles can go into overdrive, and in extreme cases, it can also induce a squint. Now, these things, of course, that does not make screens as evil as it sounded, but we need to definitely restrict screen time. In this scenario, when it seems like an unavoidable thing, we can at least follow something called as the 20-20-20 rule. This states that every 20 minutes, take a break, look at something which is 20 feet away and blink 20 times. The bottom line being, take frequent breaks and remember to blink often. The other thing that we can follow while looking at screens is that have the screen at a little lower level than your eyes, so that your viewing angle is comfortable. You're not staring right ahead at the screens. So that is another thing. You should always have some ambient light when you're looking at screens. It is a good idea to have light not directly bouncing off your screen. So diffuse light is definitely recommended when you're doing prolonged screen time. Again, larger screens are far better, and screens that are placed at a further distance are easier for viewing. Another very frequently asked question is about the role of blue blocking filters for your screen and for your eyeglasses. Now, truth be told, there is no scientific evidence to say that the blue light that is emitted from our devices causes tremendous harm to the structures of the eyeball. This blue light is more to blame for disturbing the circadian rhythm or the sleep-wake cycle. So there's evidence to say that, if you work on your screen still late in the night, you may have difficulty falling asleep. But whether it affects the cornea or the retina of your eye, there is no scientific evidence there. So that again gets me back to the question, do we use blue blockers in our glasses? Well, if you already wear glasses, you already wear prescription glasses, yes, why not? You can get a blue blocker filter, and that may ease your screen time, and it may also help with getting your sleep-wake cycle back on track. But if you don't wear glasses, I wouldn't really recommend that a blue blocking glass, just a plain blue blocking glass, is going to make a lot of difference. You could rather turn your screen into a night mode or a twilight mode. That would be a better option in such cases. Now, what do we do if there is digital eye screen? Despite all these measures, there is dryness and there are problems with the eyes. What do we do? So one thing would be to have a consultation with your ophthalmologist and to discuss ways in which you can, make your screen time better. There are lubricant eye drops available which can ease the dryness symptoms. But please check with your ophthalmologist, do not self-medicate. And certain eye exercises may help. If you regularly look at something, say on the wall, like if you're looking at a screen, whenever you take a break, just look at a wall and maybe you can read a couple of lines written on the calendar and then come back on your screen and read a couple of lines. So give your near vision a break. Give that little exercise to your eyes. That will help. That will make prolonged screen time a little better on your eyes. Now, another condition that I'd like to talk about before we end this session is retinopathy of prematurity. Now, this is a specific condition that affects premature babies and low birth weight babies. So, all babies that are born before 37 weeks of gestation and have birth weight less than 2000 grams or 2 kilos definitely need to be screened as early as possible, soon after they are born, by a vitreoretinal surgeon or a pediatric ophthalmologist. Now, what is this condition? In premature babies, what happens is that the blood vessels on the retina they have not developed fully. And because these blood vessels are not mature, they become abnormal and there is a chance that they may bleed into the eye or they may lead to vision-threatening consequences. This condition, if caught early, is amenable to treatment with lasers or injections, and it should not be ignored. Time is of the essence. So all premature babies and low birth weight babies must be screened immediately after they are born, and depending on the presence of ROP, whether weekly or as required, as recommended by the ophthalmologist. Thank you.